Hi Annette, thanks for seeing me today. My name's James. I'm a father of a 17-year-old girl, and I've got real concerns around suicide and self-harm and things. And I've got some questions to ask you. So what is suicide?
So suicide, James, is the act of deliberately harming yourself with the intention of killing yourself. A suicide attempt is an attempt to injure yourself with the goal of killing yourself, but you actually survive. And then we need to also consider suicide ideation or suicide thinking, and that's thinking about suicide. And people who think about suicide may or may not have a plan.
Okay. So what is self-harm?
Self-harm is, the technical term for self-harm is actually non-suicidal self-injury. And it refers to the sorts of behaviours that you've heard about, which are cutting and burning type behaviours, very often on the wrists and the forearms, but it can be other sites as well. And people do tend to get confused between suicidal behaviours and self-harm behaviours, but actually the biggest difference between the two is the intent. With suicidal behaviours, the person has the intent of killing themselves. With self-harm, people engage in the self-harm activity, but their intent is not to kill themselves. Self-harm is it sets up a sort of what we call a pain relief cycle, so that the person will feel the tension building up that can only be relieved if they cut or burn themselves. And you know yourself, if you burn yourself accidentally on an iron or something like that, when you take your hand away, there's a relief. And this is what people get actually addicted to. And it's the self-harm behaviours are addictive behaviours. They have the same neurological circuitry as the other addictive behaviours, substances, gambling, and other behaviours like that. And it doesn't take very many episodes of self-harm for the cycle to be set up. So there is a lot more non-suicidal self-harm behaviour than there are suicidal behaviours. The number of people engaging in these behaviours and the volume of non-suicidal self-harm behaviours has increased massively in the last 10 years. We think as a consequence of the exposure that young people have to social media models of self-harm behaviour. Self-harm may or may not lead on to suicidal behaviour. There tends to be just a tiny fraction of people who engage in self-harm behaviour who then go on to suicidal behaviour. But we always have to be very careful about looking for that tiny fraction who might move into suicidal behaviour. The differences between self-harm behaviour and suicidal behaviour, obviously there are a number of differences. The first question that you need to ask if anyone is self-harming is, does it need medical attention, suturing, cleaning the wound, and so forth. The second question that will distinguish between the two behaviours is, when you cut yourself or burned yourself, did you do it with the intention of killing yourself? And in the vast majority of cases, people are going to say, oh no, I did it to make myself feel better. I did it to relieve the tension. I did it so I wouldn't feel suicidal. And there are a number of other differences. The frequency, people engage in self-harm much more often than they do in suicidal behaviours. The methods are different, the sites are different, all that sort of stuff. But the biggest difference is the intent. And I've taken a bit of time to talk about that because self-harm behaviour is actually so common these days. If you go into high schools, probably around, in many schools, 30 to 50% of young people are actually engaging in some form of self-harm. It's also highly contagious behaviour, and of course schools are very well set up for people to copy other people's behaviours.